Welcome back. The sign-up season is here for many of you who get health care benefits through your employer. We have all seen the fancy brochures with the important charts and the graphics. It's a lot to digest.
Yeah, so to help us on that front, we have David Grunke with nearly 40 years in the health insurance industry and is now an independent consultant. David, thank you very much for coming here. So what's the best way to get us started? You know, we get these brochures, we get a lot of numbers. What do you tell people besides taking a deep breath to get through this?
The first thing I'm going to tell you is open them up. There's a lot of people who do not open the brochure or wait to the last minute to open it up. You're going to get information from your employer. You're going to get information from your health plans. Open it up.
Okay.
Once you open it up, ask questions. Somebody says, what question should I ask?
Yeah. What
network is there? Who's in the network? Just because you think it's the same network as last year, it may not be this year. We've had a coalescing of hospitals and clinics here in the Milwaukee metropolitan area, all over the state of Wisconsin. So verify that your providers are in there. Understand the coverage. The deductibles, co-insurance, and copays may have changed.
Yeah. And what those words mean.
We'll tell you about that in a second.
All right.
Ask your employer if you haven't received it. The federal government requires that you receive a summary of benefits and coverage. It's a 4-page document, and if you have multiple plans, it's a way to put them together side by side in an easy way to compare. Exactly. Know the deductibles, copays, co-insurance. One of the most important part, I say RX, RX, RX.
Oh, the drugs.
Prescription drugs.
Right.
Most of us take 3 to 7 prescription drugs. That is your biggest encounter for most of us with our healthcare plans. Look at what those deductibles are.
Right.
It's important. Most plans are going to have a mail service and a retail option. The price of those are going to be different.
Okay, let's talk about that, David, because that always confuses me. I think I'm always feeling like our employers are pushing us into the mail order option. And I'm just kind of old school. I'm used to walking to the pharmacy, talking to a human, getting the prescription and going. Is it cost effective, though, to go mail versus retail?
For you directly, most health plans will make the mail service more cost effective for you. Your copays will be reduced. Don't be afraid of mail service vendors. It's great. Same drugs that's being dispensed. Some health plans require that you use mail service for maintenance medication. So watch that. If you don't, you can still go to your local pharmacy, but you're going to be paying 100%. You're going to be paying 100% of the list price of the drug. The employers and the health plans pay a lot less than the list price of the prescription drugs.
Cost is always an issue for folks. So if you're going through this, you're seeing different plans. One will have the lower premium, the other one will have the higher deductible. Sometimes there are incentives there to take the higher deductible. How do you navigate that?
Well, you almost have to do a spreadsheet of what your health care is. Take a look at your family. You know how many prescription drugs you're probably taking, so that's the easiest one. Based on your medical conditions, you may know you have to go see a specialist because of your medical. So you're already going to put that in. You're going to have an annual physical. Put that into it.
The annual physical should be free, though, right? Don't a lot of places?
That should be free.
Okay.
That should be free.
If you have kids, there's a lot of uncertainty with kids, right?
They
can fall, they can break their arms.
Oh, okay.
And certainly with kids.
Yeah.
I have 2. It's very uncertain.
Right. So you're not going to be able to predict. They're not as predictable, right?
It's not as predictable.
So when you're looking at the lower cost versus the higher, deductible, you have to sort of navigate through that.
Well, and the health plans will give you one item in there, and it's called your maximum out of pocket. So that is the most that you're going to pay between deductibles, co-insurances, and copays. So that is one of the best ways to compare plans: is what is my maximum expense out of there, and then look at that compared to the premium. If you're a family that you think uses a lot of health care, that's a different decision from a family that has a different lifestyle and doesn't need a lot of health care.
But what happens, David, especially if you are single, you don't have the family, you never had a serious illness, you don't have a illness that you're maintaining, and you just go for your primary care, and then something happens and you get the lower premium. How do you balance that all out? Because sometimes I feel like I've never seen 80-20. Like I've never gotten to that space and place where the insurance has actually paid 80 and I'm paying 20 because of trying to figure out which one is the best.
Well, and the important concept of this is remember, these are open enrollments and they're done on an annual basis. So the decision you're making now for your health insurance for next year, it's a one-year decision. And the federal government also says if you have some changes in your life that happens during the year, your employer has to give you another open enrollment. Popular ones, not very popular, death, marriage, divorce, birth of a child, adoption. All of those allow you to take a look at your family unit and say, hey, I have a new opening here. I have a new enrollment. I can pick a different health plan within the health plans your employer offers. So remember, you're not making a lifetime decision.
You can reassess.
You don't know if you're going to have a car accident in January. We don't know that. You don't know if something's going to happen.
Right.
There is an unknown in life. But the important part is all the health plans have a maximum out of pocket. Pay attention to that. You know what your premium is. Know the deductibles, copays, and co-insurances within the plan.
And it's important to pay attention to that because while we're thinking about next year, you're coming towards the end of this year, and if there's an elective surgery, you've reached that cap. Now is a good time to get that and pay for that now versus having to pay for it later. We're out of time, but David Grunke, thank you very much for being here. Well, there